Welcome to Better Health Guy Blogcasts, empowering your better health. And now, here's Scott, your Better Health Guy. The content of this show is for informational purposes only and is not intended to diagnose, treat, or cure any illness or medical condition. Nothing in today's discussion is meant to serve as medical advice or as information to facilitate self-treatment. As always, please discuss any potential health-related decisions with your own personal medical authority.
Hello, everybody, and welcome to the show. This is episode number 20 of the Better Health Guy blogcast series. Today's guest is Dr. Jill Carnahan, and the topic of the show is Mast Cell Activation Syndrome. Dr. Jill Carnahan is board certified in family medicine and integrative holistic medicine. She completed her residency at the University of Illinois program in family medicine at Methodist Medical Center and received her medical degree from Loyola University Stritch School of Medicine in Chicago. She received her Bachelor of Science degree in bioengineering at the University of Illinois in Champaign-Urbana. Dr. Carnahan moved to Boulder, Colorado in 2010, joining medical partner Dr. Robert Rountree. She opened her own practice, Flatiron Functional Medicine, in Louisville, Colorado, to expand the services that she offers to her patients. Dr. Jill Carnahan uses functional medicine to help you find answers to the cause of your illness and the nutritional and biochemical imbalances that may be making you feel ill. Functional medicine is personalized medicine that deals with the root cause of disease instead of just treating symptoms. Dr. Jill will search for the underlying triggers that are contributing to illness through cutting-edge lab testing and tailor the intervention to the specific needs of an individual. She may use diet, supplements, lifestyle changes, or medications to treat illness, but will seek the most gentle way to help the body restore its balance. She seeks to promote wellness and create hope, health, and healing. Dr. Carnahan walks her talk. She is both a cancer survivor and a recovered CIRS patient after she encountered mold in her own medical practice. I met Dr. Jill at the Surviving Mold Conference last year in Irvine, and meeting her was a highlight of that event. She has a passion for helping people and truly cares about her work. And now, my interview with Dr. Jill Carnahan. I am so excited to have Dr. Jill Carnahan on the show today. You are an expert in so many things that I really struggled with what topic to talk about in today's show. I know you could have talked about mold, then I thought let's talk about SIBO, and then I landed on Mast Cell Activation Syndrome. And I'm really excited for listeners to learn about mast cell activation. I appreciate you being here, so thanks for taking the time out of your busy schedule.
You are welcome, Scott. I'm so glad we could finally make this work.
Awesome. I am as well. So tell us just a little bit about your own health journey. What made you the passionate person that you are today? You really do a lot in sharing information with the community. And what kind of drew you to the work that you do today in functional medicine?
Thanks, Scott. So a lot of people have heard my story, but for those who haven't, I'll just briefly share it. I was passionate about nutrition and wellness for my whole life, and I knew I wanted to do something in the health-related field. So I went to medical school, and I went the conventional route because I felt like the best way to change it from the inside out and look at wellness and prevention and how to get to root cause of illness, the true functional medicine paradigm. That would be the best way, because even though the conventional system isn't something I always agree with, where the first line is drugs and surgery, I still think that foundation was just a great way to start. So got into medical school, doing well, lots of stress, of course, as typical. And in my third year of medical school, I got diagnosed with breast cancer. So all of a sudden I was facing a life-threatening illness, and I ended up getting all the chemotherapy, radiation, and all of that. And obviously here I am 16 years later, doing great. But it was quite a journey. And through that journey, I met a wonderful naturopathic doctor and learned about the power of nutrition, just to heal the body and the gut and everything from all that therapy that I had to have for the cancer. And shortly after the cancer, I thought I was through everything, and I was diagnosed with Crohn's disease. So that's an autoimmune disease that attacks the gut, and very serious. It can be life-threatening. So it was my second life-threatening illness. And what I did, again, was look at diet and nutrition and supplements, and I cured myself from Crohn's disease.
Wow.
So that was in 2002. And yeah, so I know a lot about the gut from a very personal level. And that's why I'm so passionate about gut and immune system and all these things that correlate to one another.
Fantastic.
So yeah.
So it sounds like we could have another show on gut at some point then. That would be fun.
Absolutely.
And then tell us a little
Anytime.
bit. I know you also then had your own experience with mold illness, which got you into being a knowledgeable mold doctor as well.
Yeah, so I was going to mention that as well. So I was doing very well until 2014, and I've been running, half marathons, 5Ks off and on, and enjoyed Colorado life with the outdoors. And all of a sudden, in my office, I started getting more shortness of breath. I started having immune issues where I'd get frequent chronic infections and just very unresistant to things that would come around, viruses and fungal issues and other types of infections. So I knew my immune system and my respiratory system was compromised. At that point, I was still a little bit in denial. And I always say to patients, I get it when you're not ready to hear that there might be a mold issue that's making you sick, because it's really hard. It usually means office or car or home or somewhere that you have to leave or remediate. And it may cost thousands and thousands of dollars. So this can be a big hit financially. And I think right when I first started having symptoms, I wasn't ready to hear the truth. But eventually I got sick enough that I went looking, and I found massive Stachybotrys in the basement just under my office. And I realized that that was what was making me sick. So I left everything, moved out, and started over and began another healing journey. And today I am 99% better from that, and really have learned a lot about biotoxin-related illness, mast cell disorders, which we'll talk about today, through my own journey.
Yeah, and I think sometimes the universe sends us these things so that we can learn and really help other people. And certainly you have done that in a tremendous way. So thanks for sharing your story. Let's talk a little bit about mast cells. So let's start off with, what are mast cells? And when they're doing what they should be doing in the body, what's their purpose?
Yeah, so mast cells are present in almost all of our tissues, and especially in skin, connective tissue, intestinal lining, cardiovascular and nervous system. And they are signaling cells, and they send out all kinds of cytokines, prostaglandins, and histamine-related molecules, interleukins, to signal when there's a dangerous, something dangerous that the body feels is a threat. So this can be an issue when there is a trigger to the mast cells, because all of these chemicals can cause massive collateral damage in the body.
What are some of the symptoms that you see in your patients that have mast cell, or what are some of the symptoms that maybe people should think about exploring mast cell activation?
So one of the big ones is skin rashes or hives. That's super common, and we know that all the mast cell disorders can cause urticaria, swelling of the lips, and angioedema, and hives, rashes, all those kinds of things. Just plain old swelling and edema, like lower extremity swelling, hands or feet swelling, can also be a sign or symptom. Flushing, so that facial flushing or redness. Itching is real common because histamine often makes things very itchy or pruritic. Abdominal pain, nausea, vomiting. The whole gastrointestinal system is profoundly affected by histamines and prostaglandins, and usually it's increased motility. So you have increased salivation, increased nausea, sometimes vomiting, sometimes diarrhea. It can affect the respiratory system. So shortness of breath and palpitations, wheezing can be common, just like you would see in asthma. That's a allergic response. And then heart palpitations, so racing heart, rapid heart rate, heart skipping a beat, and anxiety. So the histamine and all the molecules from mast cells affect the brain. So things like anxiety, depression, feeling irritable or difficult concentrating, those would all be mast cell symptoms as well. And then it can affect the cardiovascular system enough to cause low blood pressure. Someone might have fainting or a drop in blood pressure. And we know often prior to shock induced by anaphylaxis, someone will just faint due to very low blood pressure. And just generalized fatigue can be a symptom as well.
Wow, that's a lot of things that I think people will certainly identify with many of those symptoms. So that's a long list that this condition can cause. What are some of the things that might lead to the triggering of or the overactivation of the mast cells?
Yeah, so the tricky thing is that almost anything can trigger. And I'm going to give you a list and you'll see how extensive it is. In clinical practice, I see very frequently biotoxins and infections, so things like mold in the environment or toxic chemicals in the environment. So any toxic trigger could trigger this, and especially mold tends to be particularly activating to mast cells. Many medications can be triggered And this would be like a lot of the allergic responses we see with medications are actually mast cell triggers, and they cause a histamine release in those allergic symptoms. And then different foods. So for some people who have sensitivities or allergic reactions to foods, say corn or wheat or dairy or egg in a certain person could be a trigger. Peanut allergy is one we know about in children, and that's real common and actually becoming much more frequent. Nowadays, the preschools, there's one or two of every classroom that has a peanut allergy. Hormones. So your own endogenous hormones can be triggers in certain cases. So women, when they're going through hormonal changes, are more prone to mast cell disorders as well. Stressors. So just stress itself can cause mast cells to be activated. And that could be like a physical stressor like cold or heat, or, really, really cold weather or extremely hot weather, or it could be also emotional stress. Odors. So noxious, very, potent chemicals and odors can trigger this. Insect bites. So if someone gets a wasp sting, we know there's this anaphylaxis reaction. That's a mast cell trigger. And in some patients, mosquito bites, spider bites, tick bites could also trigger this. And then trauma. Trauma can be a mast cell trigger. And as I mentioned in the beginning, environmental toxins, including mold, can be a trigger. So many, many, many things can be a trigger in this case.
The temperature one is interesting too, because I've talked to people that either, go outside into the cold, or they go outside and they start doing something where they just get a little bit hotter, and then they have, burning sensations in the skin, they have flushing, redness. It sounds like that potentially is mast cell related.
Yes. Absolutely could be. Mm-hmm.
So a lot of people listening today are from the Lyme and mold illness community. I've also heard things like Bartonella potentially triggering mast cells. I've heard many people talk about parasites and Candida or Candida. Any thoughts on whether those can also serve as triggers for mast cell activation?
Yes. So what we're seeing nowadays is a lot of my patients and people in general are having this massive infectious burden. I think it's kind of due to weakened immune system due to all the environmental chemicals, including mold. And so we see patients with viral loads, Epstein-Barr, HHV6, HSV1 and 2, and CMV, and other viruses. We see people with Lyme or tick-related infections, and that would be Babesia, Bartonella, Borrelia, Ehrlichia, Rocky Mountain spotted fever. Any of these can be triggers. And then there's Candida and other types of fungal issues. And really, any type of infection could be a trigger.
It's interesting because I was talking to Dr. Dietrich Klinghardt recently, and he was talking about mast cells and suggesting that the reason that the mast cells overactivate in some cases is actually because of deficiencies elsewhere in the immune system, and that it's a kind of a compensation or adaptation in a way where the immune system's doing the best that it can do. Any thoughts on that? Is mast cell activation an indication that something else in the immune system is out of balance?
Very, very good insight, Scott, because what I see is the typical patients who have mastocytosis or mast cell activation syndrome, and they're slightly different in the fact that mastocytosis is more a bone marrow type of issue. It's actually more rare. And then mast cell activation syndrome is typically what we're talking about today, where there's a trigger, infectious, cold, hot, whatever. But what I see is the patients who have the most issues with histamine and mast cell disorders typically have other immune issues, and that maybe have been induced by infection or toxin. So it's like, which came first, the chicken or the egg? But what I believe to be true, and this is just my clinical experience, is that the patients who tend to have more issues with either mold or Lyme or mast cell issues are genetic canaries that are predisposed to already have immune issues of certain branches or arms of the immune system. So while I can't prove it, I think I see a correlation absolutely with immune issues, immune deficiencies of certain types, and patients with mast cell disorders.
And would you say that it's genetic, or would we say that because of the environmental toxins and things in the environment, that those now epigenetically are just influencing the genes in a more negative way, more now than they did in the past?
Yeah, I think the best way for me to think about this is total toxic burden. So what happens is we're all swimming in this toxic chemical soup: glyphosate, BPAs, phthalates, parabens, molds, biotoxins, and then the infectious burden. And even those of us who are really clean with our water supply and our food supply, it's almost impossible to avoid chemicals. They just did a study recently with organic wine in California, and there were traces of glyphosate or Roundup found in those organic wines. So that's really kind of scary of how ubiquitous these chemicals are. And again, this total toxic burden issue is that our bodies just can't handle this amount of toxic exposure. And so if you think about it, the bucket analogy, our buckets are all full and overflowing. And that definitely is a trigger for mast cells. So this total toxic burden, and it also makes our immune systems less responsive to infections. So I think it's really just this perfect storm of everything, and especially that total burden of infection toxin in most patients, most people, is extensive. And what that does is it reveals those patients who have the underlying genetic deficiencies and issues. And so the average person who has really great genetics and really strong constitution may not have an issue with the toxic burden. That's the 95-year-old who's smoking and drinking all his life and has a long, healthy life, and we all wonder why. And then the other people like you and I, Scott, are more sensitive to the chemicals, and our mast cells and our immune systems take the brunt of that.
And would we say that heavy metals also then as an environmental toxin are contributors to mast cell activation as well?
Yes, I think it's just like whole load. And so infections, biotoxins, heavy metals, the chemicals, they all go into that bucket.
You mentioned issues related to blood pressure and mast cell activation. So there's a condition, I know you're familiar with it, called POTS, or postural orthostatic tachycardia syndrome, that some people, when they stand up, they feel really faint. Is there a connection then between mast cell activation and POTS?
Yes. So to tell you, basically the histamine activation of the system can cause orthostatic hypertension. So that's one of the main things we see in POTS. And so they are definitely correlated, because someone with mast cell activation may present with random episodes of hypotension and low blood pressure, especially if they're changing position from lying down to sitting or sitting to standing. And then we know all those infections and toxins, the same thing, can contribute to the POTS as well. I frequently see POTS with either mold exposure or Lyme disease or other infectious or toxic burden. And I don't know that I've seen a case of POTS without that. So it's very well connected. And then those are connected to mast cell activation. So they're kind of these clusters of patients that are extra sick that have infections, toxins, POTS, histamine issues, and they do kind of run in a herd. They all go together.
Absolutely. So one of the things around testing for this that I understand is that it's not that easy to test for mast cell activation, because from one moment to the next in the body, there's so much changing in terms of these chemicals. What are some of the things that you found most helpful from a testing perspective? Obviously, you look at symptoms, you look at the toxic soup, you look at infections and so on, but are there some fairly reliable ways to also test for mast cell activation?
So there are tests. They're difficult, they're not common, and they're not very accurate. So patients all the time want to be tested. I have a panel that I do, and things like total IgE, the IgG in subclasses, tryptase in the serum, histamine in the serum, anti-IgE receptor antibodies. I'll do allergen profiles. I'll do IL-1 beta, IL-6, IL-8, IL-10, and TNF-alpha. Bradykinin, chromographine A. So these are all strange labs that most doctors have not run and haven't heard of. And what often happens, even when a patient has all the symptoms of mast cell activation disorder, their labs will come up negative. So it's really a clinical diagnosis, and that's important to understand. You can do the test, and of course, if anything is positive, you are still in that category of mast cell issues. But if it's all negative and you have all the clinical symptoms, and then you treat and they respond, that's really how the diagnosis is made.
It's interesting, in the world of pandas and pans, we have the Cunningham panel. And I think in the world of mast cell, I think we need the Carnahan panel. So I think that'd be great, because there's lots of practitioners that are really just starting to get into this and just starting to understand it. And yet it'd be nice if there was, one panel of tests that they could order and kind of, get some insight as to what's really happening with their patients. I hope that some functional medicine focused lab comes out with a panel for this mast cell activation arena as well.
That would actually be huge. I just want to mention, because I have to go to multiple labs to get all of them done. There's no one lab that does all of these markers. And so it is very complex, and I've taken hours and hours to pull together. And if anyone wants resources, Dr. Lawrence Afrin, A-F-R-I-N, and Dr. Theorides, those two are experts in mast. So they're some of the people I've learned from. They have wonderful articles. And so they have a lot more information than I do. So maybe it's one of those guys' panels.
I don't know. You've got a lot of good information. Yeah, I actually have Dr. Afrin's book here, and then Dr. Theo is fantastic as well. I agree.
Yeah.
Those are fantastic resources. So in terms of symptoms in a patient, let's say they have a low level of a specific trigger, but they do have mast cell activation. Would you suggest that maybe it's actually the mast cell activation or the immune response that's creating a lot of their symptoms versus the trigger itself?
So that's a great question. I'm just pausing to make sure I make it clear. So you're saying, could it be the trigger, or actually you're saying, could it be their own immune system causing the problem
Right.
versus a trigger like a toxin or infection?
Or could the symptoms that they're experiencing as kind of their primary symptoms be more the result of that immune response to the trigger versus the microbe or the toxin itself?
Brilliant, Scott. You hit the nail on the head, maybe the most important thing we talk about today, because what happens is we have patients that like, oh, I have Lyme disease. Oh, I have mold exposure. Yes, you had that trigger, but it's your immune system and the overactive. It's like this vicious cycle. It's like you poke the bear and the bear gets angry, and that's your immune system, and it keeps going and causing massive destruction internally. So this is so key. And like I said, it's brilliant that you brought that up, because it is really the patient's own body, not the toxin, that creates ongoing damage. And that's hard for people to understand, because they'll go after Lyme with antibiotics, and they'll try to treat mold, which both things may be very important as part of their healing, but that won't heal that immune system overactivation. And so you have to get to the root cause and calm down this immune system that has gone basically wild.
Perfect. Yeah, that's really, really helpful. So you mentioned gut as well. So let's talk a little bit about foods. What role do food reactions play in people with mast cells, and when do they need to be on a low histamine diet? And then also maybe some comments on whether or not people in this population tolerate fermented foods.
Okay, great question. So what happens is histamine is a massive trigger to intestinal permeability. When you understand this, you're going to understand that anyone with mast cell issues or infectious or toxic burden that's triggering mast cell issues will have a massive leaky gut. That's also called intestinal hyperpermeability. The importance of that is that when you have these tight junctions, they should be like tiles on the bathroom wall that have the grout that's dissolved, and there's no membrane that protects. Basically, anything that goes into the tube of your gut will leak into the bloodstream and cause another set of immune activation. So what that means is they're going to be much more prone to developing food sensitivities, because these proteins from the food are leaking into the bloodstream. The immune system doesn't know what to do with them, and it'll create antibodies to them and cause these reactions and problems with food. So the first thing is, when you think about this disease, we're talking about that total toxic burden. Well, internal gut toxins, gut bugs, bacterial endotoxins, and foods can be part of that total bucket load, that burden. So by taking out foods that patients are sensitive to, they often feel better, because you're taking part of that load out of the bucket. And that typically, if we have to guess, it'll be gluten, dairy, egg, soy, corn, sugar, and alcohol. Those are the common things that I pick out if we haven't tested. Typically, what I'll do is I'll test the patient individually and find out what sensitivities they might have, and then take them off those foods. And it can be a really long list if they've had intestinal hyperpermeability for a long time. So that is part of the load and can be reduced by decreasing that. Then you mentioned a low histamine diet. Well, just like salicylates or oxalates or histamine, any of those things in the body can cause damage. And if you're getting more in your diet, some patients need to go on a low histamine diet or a low oxalate diet or a low salicylate diet. And all of those are very specific and testable. And so patients often feel better on a low histamine diet if they have a mast cell disorder. A few things, you mentioned fermented foods. Fermented foods are high histamine. So we talk about bone broth, right? This is a hot topic. There's now bone broth bars in New York City where you can go up, instead of getting a cappuccino, you can get your bone broth. Bone broth is high histamine. So while I love bone broth and it's a healthy part of healing the gut for many, many people, bone broth might not be the best thing for someone with mast cell disorders. And everybody's different. So there will be some who can tolerate it, but there'll be others who wonder why they can't drink bone broth. Fermented foods, another wonderful, wonderful gut healing thing. But for our patients with mast cell disorders, they often will not feel well when they eat fermented foods because it's high histamine. So things that are like smoked or jerkied meats, bone broth with collagen powder, or just regular bone broth, fermented foods. These are all high histamine. Cheese is high histamine. Wine is high histamine. Chocolate is high histamine. So a lot of these foods may be a problem for our patients with mast cell disorders.
So is collagen powder itself also an issue with histamine, or more the bone broth?
I'm glad you mentioned that, because the bone broth is a bigger issue.
Okay.
Not the collagen powder.
And then from a testing perspective, this is another area that's really debated in terms of people's food sensitivities and food reactions. Do you have a particular test that you find helpful for your patients?
Yeah, so your typical IgE, I will do as part of a mast cell workup, because I want to see the load of histamine producing IgEs. So if they have, I'll typically test the environmental, ragweed and Timothy grass and all the things that are in our environment. And then I'll do a food panel for IgE. And that's your classical allergy test, like any allergist would do, similar as what they would do with the skin prick test. I will also, however, check IgG allergies. And these are not really allergies at all. They're sensitivities that have developed from that leaky gut or permeability into the gut. So these are more the foods that can trigger immune reactions, and they can be related to what the patient has been consuming recently. And they are not allergies, they're sensitivities. They can still cause a burden on the system. So typically, first of all, if there's a lot of IgG reactions, I think of it as being something that is indicative of a leaky gut, because you really won't develop a lot of IgG unless you have a permeable gut. And then taking some of those out can be super helpful in reducing the toxic burden. So that immune burden is reduced when you take them out. But again, they're not classical allergies, so you'll hear allergists and other doctors say they don't use them as an allergy test. And I would agree to the point they're not allergies, but they are a burden on the immune system.
So for the intestinal hyperpermeability itself, have you looked into Zach Bush's work at all with a product called Restore? Is that something that you've had experience with?
I love Restore.
I do.
Yes, I am such a fan. I think there is nothing more powerful to heal guts that have been damaged by toxins like Roundup, mold, and Lyme. I really, really believe that. And I take it personally. Amen. It really works. Now, some people will say, I will say the caveat, people who've had fungal issues, it tends to do a great job at crowding out fungal infections. If you have active SIBO, it feeds good bacteria. So if you have abnormal bacteria overgrowth, you're going to feel bloated or gassy until you cure or treat the SIBO. So I usually treat the SIBO first and then give them Restore. Other than that, I've had no problems with it, and I love it.
Excellent. Great. So I've read about connections between mast cells and markers that we think of in the shoemaker world of biotoxins like MMP9 and transforming growth factor beta 1. So when we see elevated MMP9 and TGF beta 1, do you think that there in some people is a connection to mast cell activation? And just, I guess more generally, is there a connection between CIRS and mast cell activation syndrome?
Yeah, and boy, I wish I could tell you exactly. I hope someday I will have a diagram of exactly how these two interconnect. Number one, we know absolutely beyond a shadow of a doubt these two worlds interconnect. We've heard from Dr. Aslin and Dr. Theorides both that they see many patients with mold exposure or Lyme disease, which with what we would call in our world CIRS, that have mast cell activation issues. And we also know, like you said, that some of these markers can also indicate mast cell activation and immune activation. It kind of makes sense in my mind because mast cell activation disorders are an overactive immune system. CIRS is an overactive immune system, and both are triggered by some of the same things like toxins. So they have this massive overlap. I still cannot tell you exactly how we distinguish between who has what. It's kind of a clinical picture and a trial and error. And I think all of us in this field are trying to get more data and information so that we can really, really clearly delineate what a patient has. But I would say it's kind of like two circles that overlap. And in the middle are patients that have both. And I would say anywhere from 30 to 50% of my patients with CIRS also have mast cell issues. So it's a huge overlap.
Yeah, and it's interesting because I think of mast cell activation in people with Lyme and mold almost like another spectrum, that some people maybe don't have significant issues, others are much more impaired, but that probably most people with Lyme and mold to some extent are somewhere on that mast cell spectrum. Does that resonate?
I totally agree with you.
Okay,
Yeah.
interesting. And then what role does VIP, which we talk about in Dr. Shoemaker's work, vasoactive intestinal peptide or polypeptide, and MSH, what role do those have on mast cells? Do they help to stabilize mast cells? Does raising VIP and addressing MSH, does that also help to limit the inappropriate response of the mast cells? And is that maybe one reason why some people, when they start VIP, that they actually start feeling better?
So I'm pausing because Dr. Bernstein presented some data that showed that VIP may actually increase histamine in tissues like the lungs. So I'm not convinced that VIP is perfectly innocuous in someone with mast cell issues. I think there is a potential that they could actually feel slightly worse from a mast cell perspective. What it does do is it kind of stops the immune overactivation. So if that's the trigger for their mast cell issues, is that immune dysfunction, VIP could certainly help. But I have some question about whether or not it actually causes some histamine issues, which would be bad for mast cell patients.
Yeah, very interesting. Yeah, that's new information for me. So thank you for sharing that. So when you have someone with mast cell activation, what is the goal of treatment? So obviously you continue to work on reducing the triggers, the infections, the toxins. You at the same time, and we're going to talk about that, you're also using things to support the stability or stabilize the mast cells themselves. But once the triggers are reduced to a certain point, is there a point where the mast cell issues resolve, or is this something that requires long-term management for patients?
Great question. I have seen patients somewhat resolve, and what happens is, just like we talked about, these patients are the genetic canaries, so they may always be a little bit prone to histamine reactions. Like there's someone who, when they were a kid, they got hives or allergic rhinitis or itchiness. They're just prone to that. We call them atopic in the conventional medical world, which means they have allergies, asthma, or some sort of a allergic type of picture. And those patients, again, are always their whole life going to be prone to that. But I think you can get it much better controlled. And some of them, while for several years or lifelong, need histamine blockers. And what happens with mast cell disorders is there is a huge list of things that can be tried. You can do H1 blockers like doxepine. You can do H2 blockers like famotidine, samantadine, and ranitidine. You can do leukotriene inhibitors like montelukast, and you can do mast cell stabilizers, cromolyn, thank you. That's exactly the next one. So there's all these different things. And then I love to use natural products. So some of my favorites that I start almost everybody on are ascorbic acid in high doses, quercetin in high doses, P5P, omega-3 fatty acids, alpha lipoic acid, and acetylcysteine, and sometimes methylation donors. So those are really core as well. And almost everybody I treat for mast cell disorders will have at least some of those on board. And then Dr. Theourides came up with this proprietary blend called Neuroprotect, and I've been having great luck with that one as well.
Yeah, it's a great product. I think that's the one that has the luteolin.
Yes.
And I have also used that for years and found it really helpful. And then I've been reading some also about black cumin seed oil as another potential help. Is that something that you found any of your patients benefit from?
You know, Scott, I've just started using that, and I've had some really good results, but it's pretty brand new for me.
What would you say out of the things that you mentioned? That was actually going to be the next question that I had. So you mentioned catodophin and cromolyn, Neuroprotect, quercetin. Then we talked about some of the, and you use the chemical names, but things that I think of as like Claritin, Allegra, Singulair, Zyrtec, Benadryl, all of those kinds of things. Are there kind of two or three of them that really stand out that you find help a significant number of your patients? I realize there's probably not going to be one that helps a majority, but are there some favorites that you have there?
Yeah, quercetin and vitamin C are like so wonderful, and almost no one has a problem with those, and many people benefit. So those are like standard. Fatty acids, so omega-3s, fish oil, huge and pretty simple, and that's also part of the Shoemaker protocol for CIRS. And then as far as drugs, cromolyn I really like, and that's usually given around meals. So that's also called gastrocrom, and that's a very helpful thing, especially when patients have excessive food sensitivities with histamine issues. Plain old Benadryl can be incredibly helpful, probably the most powerful, but it also causes massive drowsiness. So we're always limited by the fatigue it causes. And then Claritin, Zyrtec, all of those over-the-counter antihistamines are often the first line because they're quite safe and they're a little less likely to cause drowsiness.
One of the things that I had read about Benadryl was that it seems for some people with mast cell issues that it can be really good at the beginning, but then it may lose some of its effectiveness over time. Do you find that these things need to be kind of rotated, or when the person finds the one that's really helpful for them, is that generally one they can do long term and continue to benefit from?
I would say if they find one that works, it often works long term, but there are some controversies over how these actually work, and do they change cell receptors or things like that, as far as like Zyrtec, because there are people who do worse on the things that you would think would help them. What I found is, unfortunately, it is completely trial and error. You really don't know who's going to respond to what, and you may need to try many, many, many things before you get something that works. And of course, there's always, you have to make sure you don't have someone who has massive drowsiness or side effects. So it can be really, really tricky. I've had a few people with chronic severe urticaria, which is hives, and they, maybe are on 6, 7, 8 drugs. It's crazy. And they might be controlled, but it takes a lot to control them. Yeah.
So let's talk about DAO. So my understanding is it's an enzyme diamine oxidase. I don't know a lot about it, other than I have had several people that I've spoken to that had mast cell activation, and when they added DAO, they really had some fairly significant improvements. People that could not tolerate foods, they had lost a lot of weight, and they started DAO. In one case that I'm thinking of, DAO along with ketotifen, I believe, and their number of foods they then could tolerate increased. They gained a healthy level of weight. Is DAO something that you use in mast cell activation as well?
Yes, and I agree. I found it very, very helpful. There's been a few commercially available DAOs, and our main supplier, which is Zymogen, recently told us that the supplier of DAO was bought out by an international company, and it is no longer available in the US, which is really, really sad. I think that goes for any brand, any product. I think whatever people are finding right now is probably what's left over in stock. But I think the sad thing is we probably won't be able to get that in the very near future.
You know, it's interesting. I'll go back and look, but I had seen the new company for DAO. I believe it's Umbrella X or something to that effect. I had seen them come online just within the last month, and had seen some people in the community talking about it. I thought that company was actually making it available now in the US again, but I'll follow up and I'll send you a link.
Please let me know.
Yeah,
because we're having shortages, massive shortages, and it's so helpful for some people, like you said. What it does is it breaks down the histamine in your food. So if someone has this, again, we talked about low histamine diet, decreasing the burden. So if you can take that with your meals, you're going to really decrease that histamine burden from food.
Yeah, so I'll post that in the show notes as well when I find that link. That way people can take a look at that. I had heard that was going to be the only source of DAO that was available in the US, and that all the other products that had it, unfortunately, many of which people found very, very helpful, were becoming difficult to get. What role does mind-body medicine play when it comes to mast cell activation? So there are tools out there like DNRS, things that people use to kind of change the way the limbic brain responds to certain triggers or certain stressors. Do you find that there is a role for mental, emotional, mind-body medicine in mast cell activation, or does that generally not play a role?
Absolutely. It's huge, because we talked in the beginning, one of the triggers to mast cell activation is stress, emotional, psychological. So, and that might be as big as any of the other triggers. So if someone's very prone to this, they can have a really stressful, heated argument, or an angry response, or a fearful response, and it could actually trigger the mast cells in them. I just think about our tachycardia and stuff, sometimes with other neurochemicals, but in some patients it could actually be histamine related. So yes, so things like meditation, where you go into an alpha wave state in the brain, or you're training your brain to be in a calm alert, be in the present, all those things, profoundly helpful. And I think everyone with mast cell issues or CIRS should be doing some sort of mind-body work.
Let's talk a little bit about probiotics. I think people oftentimes think probiotics are great and they should be on different types of probiotics, but my understanding is that probiotics also can lead to production of histamine. And so are there certain probiotics that people should stay away from? Are there certain ones that you find fairly consistently helpful for people?
Yes, this is a wonderful question, because a lot of patients find they don't tolerate certain probiotics and they can't figure out why, because they're supposed to be good for them. Dr. Januja has done some research on this, and according to her research, Bifidobacter species are quite safe. They can actually lower histamine. So I always feel safe putting someone on a Bifidobacter species, something like the commercial Align, or something with just bifidobacter. I like Claire Factor 4 is another good one. The other one's Lactobacillus rhamnosus is a very neutral one, so that one tends to work very well. Lactobacillus casei and some of the other lactobacillus can be promotional for histamine, so you have to be really careful. And then there's a whole other class of soil-based organisms and spore formers, and I find my patients with histamine issues do really well on both soil-based organisms and spore-forming organisms like Bacillus coagulans.
Yeah, and that's an interesting one. There's a lot of products that are coming out around soil-based organisms. I traditionally have used Prescript Assist Pro from Research Nutritionals. I know they just came out with a new one. I think it's called Core Biotic that apparently has even more of the soil-based organisms and the spore-type organisms. And then Megaspore Biotic is another one. I'm actually going to do an interview in the next few weeks with Kiran Krishnan, who was the creator, microbiologist involved in that particular product. And it does seem like people do really well with some of the soil-based organisms. So that's interesting to hear that even for the mast cell people, maybe the focus should be more on the soil-based and spore organisms rather than the traditional things that we get from the local stores.
Yeah, I would say definitely.
So I know it's a big topic. I know we didn't even begin to really cover mast cell activation in terms of all the things that you know about it, but are there any kind of key things that maybe we should share with listeners around mast cell activation that we didn't touch on? Anything that kind of stands out? Other things that you found helpful for people?
Well, if patients are not getting better after CIRS, this could be an issue. So a lot of patients are being treated for CIRS and chronic inflammatory response to mold or biotoxins, and they're stuck. And especially if they have rashes or tachycardia or POTS, or this mast cell piece can be huge and needs to be addressed, because if it's not addressed, they won't get better. Again, there's a trigger, so you want to address the trigger, but if you've addressed the trigger and the immune system is still acting abnormally, then it needs to be addressed. And it is really trial and error. So if you feel like you've tried a lot of things and it hasn't succeeded, keep trying, because usually there are some silver linings where patients can get help and feel better. And diet's huge. I find for patients with these issues, they really do have to limit their diet so they're not getting excess exposures. With that, a very clean diet can help immensely in mast cell disorders.
So we talked about the immune system. We talked about a lot of the things that you do to stabilize mast cells. Is there a place for things that are also immune modulators, like low-dose naltrexone or things of that nature, in terms of kind of helping to better balance the overall immune system, or does that not generally come into play here in mast cell activation?
Yes. So with functional medicine, I look at it all, and balancing the immune system is huge. So things like resveratrol and curcumin and lipoic acid and acetylcysteine, these can all be real important. And like we talked about methylation factors, which is your methyl B12, methylfolate, your P5P, and your riboflavin. And then SAMe can be a universal methyl donor. That's also a key piece, because if your methylation isn't working, you won't be able to break down histamine. And then another piece of that is if you have low copper, you won't be able to break down histamine. So there's all kinds of nutritional players in there. And typically when I'm looking at mast cell issues, I look at all the nutritional components and make sure that each of those is balanced so that the patient can make histamine or break down histamine like they should.
Perfect. So this is probably a big question, and you can give us just a few highlights, but what do you do on a regular basis in support of your own health? And I say it's a big question because I know that you do a lot of things and that you walk your talk and that you're constantly doing things to take care of yourself. But what are some of the top things you do to keep yourself really functional and well in face of all the things that we deal with on a regular basis in the environment and the world today?
Wow. I take my health really seriously because there's nothing more important to me. And I'm healthy now after all that I've been through. I'm doing really well. Basic clean air, clean water, clean food. So I have air filters at home and at work. Everywhere I go, I have a portable air filter. I have an air filter in my car. I feel like clean air, 80% of our toxic load is from our air. So we need to make sure we're having clean air sources. And when we can open the windows, that's even better because we're getting outside air inside. Clean water. I have water filters at home and work, and I have all kinds of ways to make sure my water is clean. I try to avoid drinking out of plastic water bottles unless I'm traveling. And then clean food. I'm really obsessive about my food quality. So organic, clean. I'm completely grain-free, completely organic. Although the things that I can do for food are in place. And then activity. I'm exercise fanatic because that's one way that really allows release of stress for me and makes me feel better. I happen to do Orange Theory right now, which is a high-intensity interval training and weights, and I'm a huge fan of encouraging patients to do the same. You can get a pretty short workout in a day and get a lot of benefit from that. So activity, and then just getting out in nature. Walking barefoot is profound because that earthing effect on our bodies and electrons is so healing. And then the mind-body. I practice prayer and meditation and have a very strong faith, and all of those things are incredibly important to me and my health. So that's it in a nutshell. I take a ton of supplements every day, but again, everything that I take is really important, and I'm doing well. So.
You're amazing. You're just amazing. So tell us, before we wrap up here, tell us how people can find you if they're interested in working with you as a practitioner. My understanding is that you're actually very, very busy, but if people are interested in learning more about your work, how can they find you?
Thank you, Scott. My website is jillcarnahan.com, and there is a free newsletter that will pop up there if you want to sign up. If not, just click exit out. But I would love for you to join me, and I will send out just free, wonderful content that I write every month. And if you're interested more about Mast Cell, I have a couple articles on the website. You can just search MCAS, MCAS, or Mast Cell, and that blog article will come right up. And lots and lots of free content on the website, jillcarnahan.com.
And if people want to work with you as their doctor, are you taking new patients?
I am not right now, Scott. I have a 3-year waiting list, and so wow. I am trying to catch up on that list. I do by certain referrals. So if another doctor calls me and has a patient, or if there's an excess, patients can still reach out to me, because when I hear a story that I can't help but reach out, I'll try to help whoever I can.
Fantastic. The other thing I would mention on your website that people should Google is Jill Carnahan Free Mold Guide. And that has a lot of resources that Dr. Carnahan's put together from her own experience in dealing with chronic inflammatory response syndrome and mold. Lots of great resources. I've certainly looked at it and benefited from it. So if you're interested in that information and dealing with mold illness, definitely Google Jill Carnahan Free Mold Guide and check that out. It's a great resource. I want to thank you for being here today. I appreciate how passionate you are about helping people. I love people that have taken their own challenges and diversity from a health perspective and turned it into something that really helps a broad number of people. You're certainly doing that through your practice and also through your website. So thank you so much for spending time with us today. I appreciate it and look forward to seeing you again in the near future.
You're welcome, Scott. Thank you so much.
Thanks. To learn more about today's guest, visit jillcarnahan.com. That's jillcarnahan.com. I appreciate your support of the Better Health Guy blogcast series. If you'd like to follow me, you can find me on Facebook and Twitter as Better Health Guy. The show can be found on YouTube, iTunes, Google Play, and Stitcher. If you'd like to support the show, please visit betterhealthguy.com/donate. And if you'd like to be added to my newsletter, please visit betterhealthguy.com/newsletters. I'm looking forward to many more shows ahead and appreciate your interest.
Thanks for listening to this Better Health Guy blogcast with Scott, your Better Health Guy. To check out additional shows and learn more about Scott's personal journey to better health, please visit betterhealthguy.com.